So we're going to jump right in, and I'll start with you, Cheryl, and we'll work down the line. The first question is, in the ideal world, what would workplace wellness look like in West Virginia going forward? What's the big grand vision? What are we working towards?
That's a good question. And I don't know the answer. I have, and I think I've shared it. I think Melanie's leading me. I've shared it with a few people in this room. I kind of have this, I don't know, for lack of better terms, pipe dream, an idea, a concept. Some people historically remember we used to have the nonprofit, the Wellness Council of West Virginia. That was an organization that kind of led worksite wellness for us as a state. And they had annual conferences, they had memberships, they had technical assistance, all sorts of things going on. And I kind of feel like we're missing as a state that direction. James is doing a wonderful job, and many others, Active Southern West Virginia, putting forth worksite wellness, but I kind of feel like we need to have like the bigger emphasis on it. And how do we do that? How do we develop resources? How do we get dedicated funding? We have the CDC and the Work at Health. There's also some other national entities. We used to, as a state, have a relationship with WellCOA, which is a national organization. How do we pull them back in and get them to help us? There's another national organization, National Wellness Institute, which provides some assistance, and they all can kind of intertwine and work together. So I've talked to a few people and said, hey, why do we not develop a worksite wellness state plan? So we have our obesity state plan, we have a diabetes state plan, I think, which was created last year. We have a physical activity. Why not develop pull the people who are interested together and develop a state plan so that maybe we can get a bigger emphasis within the state? Who's going to lead it? I don't know. How do we go about getting funding, all of that kind of stuff? So that's what's in my mind as a future for us, not to let it drop off the map, but somehow come together and develop a state plan and get resources.
Beautiful, beautiful. So let's continue that thought. And Lauren, if you'd like to share anything else about your background, now you can, and then dive into that vision.
Background-wise, Melanie and I have a bit of a shared history in that we have both been, 20-some year whitewater rafting guides and ski patrollers and ski instructors. That's where we passed cross in our other lives before we started working together in this level. So those are the outdoor community and outdoor activities are a huge passion for me as well. Also, my 2 teenage girls who are getting ready to leave me this year and next. So I need a little compassion there. It actually just kind of turns out that the things that I wrote down in terms of this question really do feed off of what Cheryl laid out, because the things that I kind of wrote out for it are what could be elements in a state plan. So when I took that lens and widened it out at the whole statewide level, in terms of, I kind of started with what would be my goal at a state level, and that would be that you could fill in this sentence, every worker in West Virginia has the opportunity to. Some examples that you could put in there after the 2 would be to work in an environment which supports their interest to maintain their health priorities. People are able to work and maintain an appropriate work-life balance. And then you could go from there with that. In terms of kind of what you would do under that statewide goal, I had 3 elements: recruiting, resources, and reporting. So for recruiting workplaces to participate in the Work at Health program or a similar program, county-specific materials, a statewide social marketing campaign promoting the Work at Health program. I think that could be something that would be really critical and very helpful. Success stories and data. In terms of resources, one of the things, and this is something that occurred to me throughout the day-to-day that I think would be very valuable, is statewide advisory committees based on the type of work environment that you're working in. So if you're working in healthcare, there would be a statewide advisory committee of work sites that had participated in the program in healthcare, and they could help support new groups coming in, create kind of tips and lesson learned and resources. If you're working in industry, you would have other people to talk to who work in industry, small business development, government, social services, etc. And these would not be large-term commitments, but it would be maybe a committee that would gather once a year, create some materials, and be available to answer questions for new work sites as they enter the programs. Partnerships, this feeds directly off of what Cheryl said, PEIA insurance, Active Southern West Virginia, healthcare. So in terms of both the statewide level and the local level, what partnerships are available that could be immediate resources to people, and that goes along with that county-specific materials. And then having some kind of inventory, and there's some of these things already exist, it's a matter of kind of pulling them together. Inventory of what programs, so the West Virginia Health Connection listed things like the NDPP program and the chronic disease self-management program, and a long list. I do the Dining with Diabetes program and the extension service. So somewhere having an inventory of these programs that workplaces could tap into right off the bat. And then lastly, and I'm done, reporting. And one of the things that I really would like to see is innovative promotion campaign of our successes and our data. So the kind of thing that really grabs people's attention. And that is where a place where I think there's just a huge role for our youth. How do we, instead of always reporting all these terrible top 3 numbers that we make, yay, we're in the top 3 of the worst stuff, that we are reporting, did you know that West Virginia is changing? Do you know that we have left behind the old West Virginia and we are becoming a new West Virginia? And what kinds of promotional pieces can go out that get news attention, news media attention, that could go out that are the kind of things that become viral? And that's where we would probably need some really innovative and creative thinking. So that's my spiel.
That sounds lovely.
Told you I was a thinker.
So James, how do you wrap your head around the future of workplace wellness?
Well, to add with what they have said earlier, I would like to see, she mentioned like a statewide advisory group or something like that. Just like how we used to work in tobacco, if we could get a movement going and working with the legislator and getting money, a line item for worksite wellness in the budget for West Virginia. So work sites advocating to, their representative in their area to allot money for worksite wellness in West Virginia. Even if it's $200,000, $300,000, we could do a lot with that.
I agree. So a lot of big vision there. Appreciate that insight, and we can see how we can move that forward. I want to open up for any questions or comments, and I can take the microphone around. So any feel on the vision or any comments on previous content from today?
Just what I've noticed with a lot of the other, work that a lot of us, do in addition to workplace wellness, or that's complementary to workplace wellness, is when you have people who are dedicated, their time is dedicated to the effort. So obviously the work that you all are doing, but when there's funding streams to keep, folks dedicating their time to making steps towards these bigger goals, I think that's huge. A lot of times maybe a meeting will happen, a lot of great ideas, but then it's no one's specific role to pursue them. So I think any way you can dedicate time of passionate folks to the work is good.
Great, thank you. Any other comments or questions? I appreciate that point where we do see Kathy Hills in a position to work full-time in wellness, and Jeremy Morris in a position at Columbia Forest Products to take on workplace wellness in a full-time role.
Okay, I'll preface this I started with tobacco prevention, so I've worked with Cheryl and James. But the discussion might be to try to do the sugar sweetened beverage tax and have that be the dedicated funding for wellness programs I know it's an uphill battle. We've done it before, but I think it's something that's worth pursuing for oral health, for diabetes, for the whole thing. It's just like that's a huge issue in our state, and that could be an opportunity to gain some money for those programs.
Good idea.
Yeah.
Thank you.
Preaching to the choir here.
Yep, somebody write that down.
I'm writing it down right now.
And a show of hands, did you like the idea of segmenting by sector within workplace wellness? So industry and healthcare and education have a bit of a network within workplace wellness. I think that's a great initiative to move forward to and see what that may look like. Any other side comments? I do want to continue. This is just the beginning of the conversation on statewide plan and what that can look like.
Thanks, Melanie. I guess thinking about maybe champions for this kind of work, whether it's within like a healthcare payer or the legislature, do we know of anyone that may be already pursuing this kind of thing, whether it's a covered benefits or in the legislature as like a place to start, or that could be another next step.
James, do you have any leads on that? I know that Jessica has worked in that arena to try to move in that direction of more state funding for health and wellness initiatives.
Well, maybe after her retirement, we could talk her into being a champion for this cause. Because as it is now, she couldn't, do any type of lobbying for
Right.
the legislature or anything. But after she leaves, she might be able to do something like that.
We would need to start building a list because there are people throughout the state who aren't here that we would be able to recruit that would be very interested in a statewide program like that.
That sounds great. It can definitely be a big chunk of next year's conference and convening stakeholders with a statewide plan.
Starting to, kind of identify who might be supporters.
I'm not familiar with a bunch of this, but is there something on the national level as a support that could be used in like benchmarking the journey of other states?
Yes, and that's where I'm going to lean on Cheryl and James for more of those national organizations and data. And Cheryl was already mentioning this morning about looking at Ohio and some of their best practices. And then Maryland Health Department, I've watched their progress through the Work at Health program as well. So I appreciate that comment, because also looking at examples when we look at our sectors, like Lauren mentioned, it doesn't just have to be in West Virginia that we find companies of the same size and sector.
We used to have a huge advocate as part of our program. Some of you may know her, Dr. Emily Murphy. She's been a big piece of health advocacy in West Virginia for a long time. And she doesn't work with Extension, but she still works with the university, and she's one of the first people I thought of that would be involved in that. We do have several other agents who are work at health trainers as well, and there would be an opportunity for Extension to support that.
I didn't know if they were all taken up with what they do.
Yes and no, but just because they're really good at saying yes, even when they shouldn't. But so if this was something we knew was going forward, and I think that's the kind of thing we may need, like an executive committee between now and next effort, who kind of put together the bones of how that that statewide plan gets developed, so that when we meet as a bigger group, people have something really specific to work with. That would be my recommendation there. And that way we can make that ask with specific interests involved. We would like you to come to help us with that. And so that we're, and we might be able to break out into those different sectors, that kind of thing. I would also advocate, I mentioned it once before, but not just for the reporting and media issues, but I think we should have a youth element. The future of West Virginia is absolutely in their hands. It's not going to be us who are going to reaping those benefits. It's going to be them. So I would like to see us have a youth/student element involved in this planning.
Maybe reach out to the future business leaders of America.
I haven't reached out to anybody. Just you all. But we can talk about that kind of thing.
That sounds great. So that we're just off the cuff. We're shooting off other stakeholders to engage, some framework, some ways to really format this and move it forward. So I think we've already made a lot of accomplishments with the idea of the statewide plan. So appreciate that conversation.
Really, today was so rich because of everything you all brought to the tables today. We didn't do too much talking at you. There was so much discussion, and some of the most valuable pieces, I think, came from you all today. And for me, it's just so exciting to see. I speak with so many of you. Some of you I'm meeting for the first time, but speak with so many of you all individually, emailing back and forth, working with you one-on-one. But to be able to introduce you all to each other means so much to me. It's so important that when we leave here today that we remember these types of conversations. There are people here, we have the connections and the interest and the passion to create something like a statewide plan. So don't forget that big picture when you go back to your workplace. Sometimes the churn can be hard on the day-to-day, trying to drag out your employees to actually come to these events that I know you're putting your sweat and tears into, going door to door, handing out paper surveys, saying, please give me something to evaluate so I can keep doing good programs for you. So when you get in that kind of mire of the day-to-day, remember moments like this, remember the success stories, the information that we've shared today. It's all worth it. It really does pay off, and you're making a difference to someone. It might just be one person at a time, but it is a ripple effect, just like our shirtless dancing man up there. So I encourage you all, if you're not the shirtless dancing man, to be the first follower and keep this ripple effect going. This year we started out kind of small as our first conference, right? But we hope to do this again and again, and to see even more of you and your colleagues, and maybe you can bring your boss out if you think that was something that you sure would like them to have heard, straight from the horse's mouth. Anyone here is not already working with Active Southern West Virginia, I encourage you to be in touch. There's so many resources that not only that we can share with you, but that we really want to share with you. There's a lot of enthusiastic people here that want to keep helping your workplace wellness program growing. Is there anything I missed? All right, well, thank you all. It's been such a pleasure, and let's do it again.